And tomorrow we're going to have one of the biggest announcements.
The Trump administration in the US was set to line a very common drug to autism and pitching another drug as a possible treatment.
You know what MAHA is? That's right. Make America healthy again.
American health officials are preparing to warn pregnant women against early use of acetaminophen, known in India as paracetamol, the ingredient in crocin, Dolo 650, etc. Research by Harvard and Mount Sinai suggested a possible link between taking the drug in early pregnancy and a higher risk of autism in children. Indian doctors widely prescribe paracetamol in pregnancy as a safe pain and fever reliever. If the US puts out a formal warning, it will inevitably spark debates here too, where crores of women rely on the drug.
I think we found an answer to autism. How about that? Autism.
Now, Trump's team is also pushing leucovorin, a drug usually given for vitamin B9 deficiency or chemotherapy side effects, as a potential treatment for autism. Some small clinical trials abroad found autistic children on leucovorin showed improvement in speech and comprehension. If this line of research gains momentum, it could open new markets for autism medication in India, where parents often spend years trying therapies with limited results.
We're going to be talking in the Oval Office in the White House.
Donald Trump has made autism a personal crusade. His health lieutenants include Robert F. Kennedy Jr., RFK Jr., and well-known conservative doctors.
I think you're going to find it to be amazing.
The problem? Many scientists warn this is being rushed for politics. Establishing causes or treatments for autism usually takes years of careful research.
Because obviously there was something really wrong, and we think we know what that is.
Massive usage. Paracetamol is India's go-to drug for fever and pain. Any global warning could panic pregnant women and force Indian health agencies to issue clarifications. India has rising autism diagnoses but patchy support systems. If leucovorin is promoted as treatment, desperate families may rush to import it or push doctors to prescribe it, well before its effectiveness is firmly proven. Whenever the US redraws drug guidelines, it has a domino effect in countries like India, where regulatory bodies often follow suit. In short, Washington is hinting that paracetamol might increase autism risk in pregnancy and that a little-known drug could treat autism. But the science is far from settled. For India, where paracetamol is practically a household staple and autism care is under-resourced, this could become a big medical and public debate in the months ahead. I'm Manish Adhikari. Thank you for watching First Things Fast.
More.